Hi, beautiful people. How are ya? I hope you're having a great day. Thank you for asking about my puppies. We've been busy around here with Goldie. She's our Jack Russell Rat Terrier mix. She's 18 years old and she hurt her back right leg somehow. We're not sure how. My husband thinks maybe Tesla was being too rambunctious with her and knocked her over because her balance is pretty bad, but I'm not sure. I mean, she could fall over easily all by herself. She's not able to move around. She's not a young pup. I mean, think about it. She's 126 in people years. So she wouldn't walk on her back leg. Lucy's come to join us, I guess. Right on my pillow. There we go. She's comfortable. Pillow's back here. She's getting around a lot better than she was. She can get down the back porch steps, and today she came up the back porch steps all by herself. What we had been doing was carrying her down and carrying her back up. We did give her a little pain medication, and that helped her rest and settle. Our family sent many, many prayers for her, and our youngest son has been spending the week with us. They have a close bond. I mean, he grew up with her. I'm just relieved that she'll put a little bit of weight on that leg now, because honestly, we thought we were going to lose her in the beginning. And that in turn caused me a lot of anxiety. And, when you're frozen with anxiety, it's hard to get much of anything done, which was okay in that respect because all I wanted to do was take care of her. I know that day is going to come, but you're never ready for it. So let's talk about something a lot more positive because she is doing better. Tesla's down here snoozing. Lucy back there, and Goldie sleeping in her bed in the bedroom. And that's nice. She's taking a good rest. In a recent video, I spoke about fibromyalgia chest pain, specifically costochondritis, an inflammatory condition. Because of a comment from one of you beautiful people, today I want to talk about some other symptoms that some of you may not know that seem to really move right along with fibromyalgia, and that's heart palpitations. Costochondritis can sometimes be confused with heart palpitations. Costochondritis is not a heart problem, and heart palpitations may or may not be a heart problem. Heart palpitations can feel like your heart is skipping beats, having an extra beat, fluttering rapidly, beating too fast, like your heart is racing, pounding, or flip flopping. We can get these symptoms from stress, medications, exercise, or rarely from a medical condition. Usually, they're harmless. I get them. According to my cardiologist, they're not concerned. Anxiety is a major cause of heart palpitations. I have general anxiety disorder, so that explains my heart palpitations for the most part. But usually they occur when I'm resting, or at least that's when I notice them. Our emotions play a huge role in our lives, don't they? Feeling stressed, anxious, fearful, or panic can result in palpitations. But too much caffeine, an overactive thyroid, low levels of sugar, potassium, or oxygen, certain medications like asthma inhalers, beta blockers, thyroid meds, and antiarrhythmic meds can cause them. Also, cough and cold meds like decongestants, some herbal or nutritional supplements, nicotine or alcohol can also cause them. Other than palpitations occurring with anxiety, you can also experience them after eating or only at night. But like me, that might just be because you're not noticing them because you've been too busy during the day or just too distracted by life. If you sleep on your side or stomach, that pressure can cause palpitations. But since I have GERD and sleep apnea, I need to sleep on my left side for a better night's sleep, according to my gastroenterologist. However, arrhythmias, meaning an irregular heartbeat, might be the cause of palpitations. Abnormal heart rhythms are when the heart will beat either too fast or too slow, or irregularly. It might feel like fluttering or racing. It might require treatment, but not all arrhythmias do. I've also been diagnosed with arrhythmia but don't need treatment for it. Arrhythmia treatment may include medication, implanted devices, or surgery to control or eliminate fast, slow, or irregular heartbeats. Or they might do a catheter procedure. A heart healthy diet and lifestyle can help prevent heart damage that can trigger certain heart arrhythmias. Basically, heart arrhythmias are grouped by how slow or fast the heart rate is. For example, tachycardia is a fast heartbeat. This is when the resting heart rate is greater than 100 beats a minute. Bradycardia is a slow heartbeat. The resting heart rate is less than 60 beats a minute. You might feel heart palpitations in your throat or neck, as well as your chest, and they can occur when you're resting or during activity. If your heart palpitations only occur infrequently, like mine, and last only a few seconds, then you may not need any treatment. About 1.5 to 5% of people in the US have arrhythmias, but some don't have any symptoms. They can be harmless or serious. If you have a history of heart disease and palpitations occur more frequently or worsen, then you need to see your healthcare provider. They may want you to wear a heart monitoring device overnight for a few days to test if you have a more serious condition. They may also want to do an ECG, EKG, stress test, urine test, echocardiogram, or do blood work. In extreme situations, they may want to do an electrophysiology study or cardiac catheterization. Fibromyalgia patients have significant autonomic symptoms, but modest autonomic dysfunction, according to research. Autonomic issues include orthostatic intolerance, specific symptoms when standing that are relieved when reclining, vasomotor, which is our blood vessel dilation, secretomotor, which relates to our nerves and glands, gastrointestinal, which stretches from our mouth all the way through to the end of our large intestine, bladder, pupilomotor, which are nerve fibers in the smooth muscle of the iris. So, this entire autonomic nervous system is messed up. According to other research, standing can be a huge issue for most of us. Researchers stated, according to Health Rising, that heart rates should quickly ramp up during standing, but then ramp down. In fibromyalgia, heart rates never rose very high and failed to ramp down as much. Like while they were lower at first, they remained elevated longer than normal. The same strange pattern occurred with the systolic and diastolic blood pressure readings. They both showed less variation during standing compared to healthy people. When it comes to issues of the heart and blood pressure, most heart palpitations are completely harmless and not a cause for concern. It's a normal response to stress or anxiety, our body's way of alerting us to slow down and rest. I need reminded of that. Our autonomic system in everyone regulates our heart rate, body temperature, breathing rate, digestion, and sensation. In fibromyalgia, our autonomic system is dysfunctional. Many people with fibromyalgia will experience racing heart or pounding after they rise from a seated position. They may sweat or have difficulty concentrating. This is usually anxiety related, but people with fibromyalgia may have POTS or neurocardiogenic syncope. One is tachycardia related, and the other is bradycardia related. But a slow heart rate can also be an issue if you're not physically fit. I mean, I hope your physical fitness is better than mine. Bradycardia may be the result of hypothyroidism, chemical imbalances, obstructive sleep apnea, inflammatory diseases, and more. Frequent fainting or cardiac arrest in extreme cases might result. My heart rate prior to medication would drop really low when I was going to faint. And during the faint, it would completely stop for like 8 seconds and then obviously restart. Many people with reflux syncope experience this, which I'll talk about in a moment. Often, reflex syncope requires a pacemaker to regulate the heart rhythm and speed the heart up as needed. Many researchers state that there's a higher risk of heart disease in people with fibromyalgia, but that doesn't mean that you're going to develop heart disease. Healthy changes to your lifestyle and diet can change that, and genetics may play a part. Seek medical attention if you're experiencing palpitations all day or have chest discomfort or pain, fainting, severe shortness of breath, or severe dizziness. Heart palpitations are the most common reason a person sees a cardiologist, and 16% of people who see their primary care doctor went because of palpitations. So don't feel abnormal for seeing your doctor. When you see your doctor, go prepared to answer the following questions or let them know these details. When and how often palpitations occur? How long do they last? How you feel when they happen? What you're doing when they start? What helps you feel better? So let's talk about POTS. This disorder is related to fibromyalgia. It appears that many people with fibro and especially ME/CFS have this tachycardia issue. It's referred to as neurally mediated orthostatic hypotension, postural orthostatic hypotension syndrome, POTS, is not an anxiety disorder. It's caused by autonomic dysfunction under the dysautonomia umbrella. All the symptoms of POTS are physical. You probably don't experience panic or worry in the way you would with an anxiety disorder. You might experience confusion, lightheadedness, or brain fog, but these aren't psychological. When the pulse goes up, this isn't technically a palpitation. Instead, it's considered tachycardia, a sped up heart rate. POTS patients are misdiagnosed with anxiety before receiving a POTS diagnosis. Usually, a cardiologist will determine the type of ANS, autonomic nervous system dysfunction, that you have through a tilt table test. If tachycardia is found during the test, they call it POTS. The heart rate needs to rise more than 30 beats a minute after more than 3 minutes of standing upright. The heart rate is stable but elevated, and the blood pressure doesn't drop. But if you're in a reclined position, your symptoms will slowly subside. You might need extra sodium in your diet. High sodium electrolyte drinks are often preferred, or salt tablets. Medications and compression socks are often used. And it's extremely common to have POTS and ME/CFS, like almost half, about 43%. The heart rate can reach 160 beats per minute or higher. People often experience palpitations, exercise intolerance, severe fatigue, near syncope, lightheadedness, and dizziness. Cognitive impairment and visual disturbances can be experienced, as well as intolerance to heat while always feeling cold. People with diabetes or joint hypermobility may experience POTS. If you have fibromyalgia and gastrointestinal motility disorders like IBS or GERD, or hyperhidrosis, that disorder that causes you to sweat excessively, or another condition like restless leg syndrome, developing POTS is common. A viral infection, trauma, or surgery are also suggested as precursors. Now let's talk about reflex syncope. This involves bradycardia. Bradycardia, or low heart rate, is common in older adults, and our heart rate tends to slow down while we're sleeping. Some people with fibro have vasovagal syncope issues. About 16% with fibromyalgia and 24 to 28% with ME/CFS. This is known as neurally mediated reflex syncope. This falls under the dichotomy umbrella too. This causes a centrally mediated or reflex fall in systemic blood pressure. So, unlike POTS, the blood pressure will fall in reflex syncopes. Usually, this begins before age 40 and often in the early teen years, but not always. It can begin in older adults too. About 1 to 1.5% of all emergency visits are due to syncope. And remember, syncope is fainting. About 40% of the U.S. population will experience syncope at some point in their life. Arrhythmias are not a part of this reflex syncope. It usually occurs as a reflex reaction to something around you, such as heat exposure, fear, pain, or stress, or from a sitting or lying down position to standing up, or from getting your blood drawn, standing in hot temperatures, coughing, gastrointestinal issues, or even exercise. There is a whole group of these disorders. I'm referring to the specific reflex syncope that is typically associated with bradycardia and results in hypotension or low blood pressure and loss of consciousness. This doesn't lead to death or cause it, but falling and hitting your head when you faint can be a big issue. The most frequent type of reflex syncope is neurocardiogenic syncope or vasovagal. There's another one called carotid or carotid sinus syndrome, but we're not going to talk about that one. That one isn't found frequently in fibro. So, this is when the nervous system doesn't function properly and is characterized by fainting. Heart rate and blood pressure drop, the flow of blood to the brain is reduced, and the person faints. What is supposed to happen is when the blood flow is distributed to the legs when standing, which happens to everyone, the leg muscles are supposed to contract and pump blood back to the heart so the brain receives the proper blood flow. Obviously, this doesn't work properly in people with this condition. In neurocardiogenic syncope, prolonged orthostatic stress is considered the pathophysiology. Orthostatic stress results from actively standing or during a lower body negative pressure test or a head up tilt test. And this is a picture of a machine or a device that's used normally in space medicine, but in recent years has been used to determine orthostatic issues. 25% of people with reflex syncope will have another event within 2 years. Warm environments, dehydration, tight clothing, standing up too quickly or turning the body too quickly, or anything that causes distress can bring on a syncope or faint. Sometimes the symptoms of pale skin, lightheadedness will be experienced prior to fainting, and other times there's no warning. The room can go black, or the hands might break into a clammy sweat just prior to a faint. And sometimes a pacemaker is needed. Do any of you experience any of these symptoms? What's your diagnosis? So, to sum up, most of us will experience heart palpitations at some point in our life. Most are benign or cause you no issues, such as what you experience from anxiety, or you have an autonomic issue like POTS or neurocardiogenic syncope. And lastly, you should always talk to your doctor about your palpitation issues and make sure that you don't have something worse. I hope you learned something. I send you gentle hugs and support. Love you so much. Have a great day. She's our 18-year-old Jack Russell Rat Terrier blend mix. But basically, heart arrhythmias or cardiac catheterization. So we have issues. Many people with fibromyalgia will experience the work. Did I say that? And nausea will be